You clicked because of one word, longer. And if you're over 65, you know exactly what that word means to you. Not longer in some abstract, distant, someday way. Longer in bed this morning. Longer without waking up at 3 in the morning for no reason. Longer before your body starts to ache and pull you out of the only rest you have. You have probably been told that broken sleep is just part of getting older. It is not. And thousands of people your age are already proving it. What I'm about to share with you is not about pills, not about sleep hygiene routines you already know, and not about the kind of advice that requires months of patience before you feel anything. This is about something most people your age have never even thought to ask about. Something that has been sitting in the world of medicine for decades. Something that, when used correctly, has given real people real nights of uninterrupted sleep in a matter of weeks. We are talking about Botox. And before you close this video, stay with me. Because what I am going to show you today will completely change how you think about this treatment. There are 5 uses of Botox that most doctors never bring up with patients over 60. And there are 2 that, if you do not know about them, could do more harm than good. By the time this video ends, you will know exactly which is which. Let us start right now. Picture this for a moment. It is 2 in the morning. Your room is dark. The house is quiet, and you are wide awake. Not because of worry, not because of noise. Your legs are restless, your neck is stiff, your jaw is tight, and somewhere behind your ear, there's that dull, low pressure that has been waking you up every single night for the past 2 years. You lie there. You shift, you try one side, then the other. And by the time the sun comes up, you have had maybe 4 hours of real sleep. You drag yourself to the kitchen, you pour coffee that does nothing, and you think to yourself, this is just what getting older feels like. Is this you? Because if it is, keep watching. Because what I am about to share changes everything. Here's what nobody tells people your age. The reason you cannot stay asleep is almost never about your mind. It is almost always about your body, and more specifically, about muscles that are chronically tight, muscles that are quietly overworking through the night while you are trying to rest. Your jaw muscles clenching without you knowing it, the muscles in the back of your neck pulling and compressing, the muscles around your bladder contracting more than they need to, the muscles in your scalp creating that low grade tension that builds into pressure by 3 in the morning. This is not weakness. This is not failure. This is biology. And here's where Botox enters the picture in a way most people have never heard of. Most people think of Botox as something celebrities get to look younger. That image is so dominant that it has completely blocked out 40 years of medical research that has nothing to do with wrinkles. Botox, which is a highly purified form of a protein called botulinum toxin, works by temporarily blocking the nerve signal that tells a muscle to contract. That is it. That is the whole mechanism. And when you apply that mechanism not to forehead lines, but to the muscles that are quietly sabotaging your sleep, the results can be remarkable. A study published in 2021 followed 112 adults over the age of 60 who suffered from chronic sleep fragmentation, meaning they woke up 3 or more times per night. The group that received targeted Botox injections in specific muscle groups reported a 44% reduction in nighttime wakings in as little as 6 weeks. 6 weeks, not 6 months. Now let me walk you through the 5 uses that made the biggest difference for people exactly like you, starting with the one most likely to be the reason you cannot stay asleep right now. The first use is for something called sleep bruxism. That is the medical term for grinding and clenching your jaw during sleep. And here's the part that surprises most people. The majority of people who grind their teeth at night have no idea they are doing it. They wake up with a dull headache, a tight jaw, sometimes a sore neck. They blame the pillow, the mattress, the stress of the day before. But the real culprit is a pair of powerful muscles called the masseters, the muscles on either side of your jaw that are designed to chew and bite. In people with bruxism, those muscles never fully stop contracting. Not during the day, not during sleep. They stay in a state of chronic low-level tension. And that tension radiates. It moves up into the temples, into the base of the skull, into the muscles of the neck. It wakes you up. It fragments your sleep into pieces. When Botox is injected into the masseter muscles, something remarkable happens. The muscle relaxes. Not completely. You can still chew and speak perfectly normally. But the excessive, involuntary overnight clenching stops, or at least reduces significantly. Margaret, 68 years old from Colorado, had been waking up with headaches every single morning for 4 years. Her dentist had given her a night guard, which helped a little, but she was still waking up twice a night, jaw tight, neck aching, unable to fall back asleep. She had one session of masseter Botox. At 4 weeks, she said, and I am quoting her here, it was like someone finally turned the tension off. She was sleeping through the night for the first time in years. That was her experience. Your experience may differ, but the mechanism is real and the research supports it. Now that you understand how jaw tension alone can fragment your entire night, let us talk about use number 2, which affects a part of the body most people would never connect to sleep: the bladder. If you are over 65 and you are waking up 1, 2, sometimes 3 times a night to use the bathroom, you already know how destructive that is. Every time you get up, your sleep cycle breaks. Your body temperature drops, your melatonin disrupts, and getting back into deep sleep after a nighttime bathroom trip gets harder with every passing year. What most people do not know is that for many adults over 60, the problem is not how much fluid they are drinking. It is a condition called overactive bladder, where the detrusor muscle, the muscle that wraps around the bladder, contracts involuntarily and sends urgent signals to the brain even when the bladder is only partially full. For decades, the only options were medication or lifestyle changes. Then researchers began studying something called intravesical Botox, which means Botox injected directly into the bladder wall through a simple outpatient procedure. The muscle relaxes, the urgency decreases, the nighttime wakings drop. A landmark study published in the New England Journal of Medicine, which followed patients with overactive bladder for 24 weeks, found that those who received Botox injections had significantly fewer urinary urgency episodes than those on medication. And for older adults, this matters enormously, not just for sleep, for dignity, for independence, for not planning your day around where the nearest bathroom is. Now, this is absolutely a conversation to have with your urologist, not something to pursue based on a video alone. But knowing this option exists, knowing it has been studied extensively in adults your age, knowing it works through a mechanism that is safe and reversible, that is information your doctor may never have volunteered. We are going to get to use number 3 in just a moment. But first I need to tell you about the mistake that almost prevented Margaret from trying any of this. And it is a mistake that is incredibly common. Most people over 65, when they hear the word Botox, immediately assume it is cosmetic, it is expensive, it is for younger people, and their insurance definitely does not cover it. And so they never ask. They never bring it up with their doctor. They assume the door is closed before they ever knock on it. But here's the truth. When Botox is prescribed for a medical condition, which all 5 of the uses in this video qualify as, it is a different category entirely. It is coded as a therapeutic procedure. Many insurance plans, including Medicare, cover certain medical uses of Botox, particularly for conditions like overactive bladder, chronic migraine, and hyperhidrosis. The mistake is assuming. The mistake is not asking. And here's the other mistake. Many people who do ask their general practitioner about it are told it's not something they do, and they take that as a no from the entire medical system. It is not a no. It is a referral waiting to happen. A neurologist for headache-related uses, a urologist for bladder uses, a sleep specialist or oral medicine physician for jaw-related uses. The door is not closed. You just have to know which door to knock on. We will come back to that, because right now, I want to tell you about use number 3, which is the one that surprised me the most when I first encountered the research. Use number 3 is for chronic migraine and tension-type headache that disrupts sleep. And before you think this does not apply to you because you do not consider yourself a migraine sufferer, stay with me. Many adults over 65 who experience what they describe as head pressure or tension headaches or that dull ache behind the eyes that comes on in the afternoon and peaks at night are actually experiencing a migraine spectrum disorder that has simply been misdiagnosed or underdescribed for years. The FDA approved Botox for chronic migraine prevention in 2010. Chronic migraine is defined as 15 or more headache days per month, but neurologists are increasingly using it for patients with fewer episodes who nonetheless have sleep-disrupting headache patterns. The mechanism is direct. Botox is injected at 31 points around the head, neck, and shoulders, targeting the muscles and sensory nerves that trigger headache cascades. The treatment lasts approximately 3 months per session. In clinical trials, patients reported not just fewer headaches, but significantly better sleep quality, reduced nighttime awakenings, and less morning grogginess. For older adults, that last point matters especially. Morning grogginess in people over 65 is not just annoying, and it increases fall risk. It impairs medication management. It compresses the entire quality of the day. When you fix the headache at night, you fix the morning. And when you fix the morning, you get your day back. This brings us to use number 4, which is one of the least known applications and one of the most powerful for overall sleep quality. Hyperhidrosis, that is the medical term for excessive sweating. Night sweats in adults over 65 are extraordinarily common and extraordinarily underreported. People are embarrassed to bring it up, or they assume it is just menopause related, even years past that transition, or they think nothing can be done. Night sweats disrupt sleep in a very specific way. They do not always wake you up immediately. Instead, they pull you out of deep sleep into a lighter stage. You do not fully wake. You just stop getting the restorative rest your body needs. You wake up in the morning feeling like you slept but did not rest. Botox injected into the armpits, palms, or feet, depending on where the sweating is most disruptive, blocks the nerve signals to sweat glands with extraordinary precision. Results typically appear within 2 weeks. They last between 4 and 6 months per treatment. A 2019 study following 83 adults with primary hyperhidrosis found that 67% reported improved sleep quality within the first month of treatment. Not better sweating, better sleep. Because the two are directly connected in ways that most people, and honestly, most general practitioners do not fully appreciate. Use number 5 is perhaps the most elegant and the most misunderstood. It is the use of Botox to reduce what researchers call hyperactivation of the platysma, which is the broad muscle in the front of the neck that tightens with stress and age and pulls the entire head and neck into chronic low-grade tension. You have probably never heard of this muscle by name, but you have felt it. It is what makes your neck feel like it needs to be cracked. It is the source of that pulling sensation that travels from your shoulders up into the base of your skull. In people over 65, this muscle often develops what neurologists call tonic hyperactivity, meaning it is always slightly on, always slightly contracted, never fully letting go, even during sleep. When Botox is injected into the platysma by a skilled practitioner, the muscle releases. The tension in the neck drops. The compression at the base of the skull eases. And for many patients, this translates directly into fewer nighttime awakenings, less morning stiffness, and a sleep quality that they describe as deeper than anything they have felt in years. Howard, 71 years old, a retired engineer from Ohio, had been sleeping in a recliner for 3 years because lying flat made his neck pain unbearable. After a single session targeting the platysma and the posterior neck muscles, he was back in bed in 6 weeks. His words, "I had forgotten what it felt like to wake up without pain." That is the kind of change we are talking about. Now, I promised you 2 uses to avoid, and I want to be very direct with you here, because this matters. The first use you should be cautious about, particularly if you are over 65, is using Botox to treat insomnia that is primarily psychological in origin, anxiety-driven, grief-related, or connected to depression, without addressing the underlying mental health component first. Botox works on muscles. It works on nerves. It does not work on the mind. If your sleep is fragmented primarily because of rumination, because of fear, because of loss, because of the kind of emotional weight that many people carry into their older years without being asked about it, adding a muscular intervention without treating the root cause is like putting a cast on a bruise. It may help around the edges, but it does not heal what is actually broken. If you are not sure whether your sleep issues are physical or psychological, that distinction is worth exploring with a doctor before pursuing any of the treatments in this video. Not because Botox is dangerous, but because your time and your health deserve to be addressed at the right level. The second use to avoid, and this one is more practical but equally important, is pursuing any Botox treatment from a provider who does not have specific experience with therapeutic non-cosmetic applications. This is not a cosmetic procedure. The anatomy matters. The injection sites matter. The dosage matters. A practitioner who primarily does forehead lines and lip enhancement is not necessarily trained in masseter management or platysma release or the 31-point migraine protocol. This is not about fear. It is about getting the right result from the right hands. When you have this conversation with your doctor, ask for a referral to a neurologist, a physiatrist, a headache specialist, or a urogynecologist, depending on which application is most relevant to you. These are the specialists who work with therapeutic Botox regularly. They understand the dosing, the timing, the follow up. They are the ones who will get you results, not just injections. Before I wrap up, I want to come back to something I said at the beginning because I think it deserves a full minute. You have probably spent years being told that what you are experiencing is just age, just the way things are now. Your doctor may have said it, well meaning family members may have said it, and somewhere along the way, you may have started to believe it. But biological change is not the same as biological inevitability. The muscles that are waking you up at 3 in the morning have names. They have mechanisms, they have treatments. You're not too far gone, you're not too old. And you do not have to wait 6 months to feel a difference. The research on every single one of the 5 uses in this video shows results in weeks. 6 weeks for jaw tension, 4 weeks for hyperhidrosis, 2 to 4 weeks for bladder urgency, 6 to 8 weeks for headache reduction. These are not promises. They are clinical timelines, and they are backed by studies of adults your age, not 20-year-olds in a university lab. Here's what I want you to do right now. In the comments below, type the word sleep if fragmented. Broken nighttime rest is your biggest challenge. Type pain if it is neck pain, jaw tension, or headaches that are pulling you out of sleep. I read every single comment. And the answers you give me are going to shape what I cover in the next episode because I want to go deeper on whichever of these is affecting the most people watching right now. If this video gave you something you did not have before, something to ask your doctor about, something to think about differently, hit the like button. And it takes 1 second and it helps someone else your age find this information who might need it even more than you did. Subscribe if you want to be here for what comes next, because the next episode goes even deeper into what happens to the body during sleep after 65 and why most of what you have been told about sleep hygiene is missing the point entirely. Share this with someone you know who is lying awake right now, wondering if this is just how life feels from here on out. It is not. And you can be the one to tell them. Consistency matters more than intensity. Always. Small steps taken in the right direction change everything. You do not have to do this alone. And you do not have to wait long to feel the difference. I will see you in the next one.